Alright, no? So for today, we'll have an asynchronous of FES and ES Lab. Okay. So in our lecture time, we'll have a discussion about FES and ES as well. As for the laboratory part, no, we'll discuss the parameters and some of the considerations, no, when applying these electrical stimulations, no, to different scenarios or to different approaches. Okay, so let's start first with the FES. Okay, so in FES, no, this is almost the same as your NMES, no? But the NMES, no, medyo ano siya, you start with an NMES and then you later on progress to FES, no? Because your FES, no, has a pre-requirement. Okay, you have to have at least 3 minus over 5 of MMT grade of your target muscle. Okay, with an exception. Okay, with an exception to shoulder subluxation. No? Under kasi siya ng FES. Alright, because there's a movement involved. Okay, but for upper extremity function and for ambulation, kailangan meron kayong at least 3 minus over 5. Okay, dapat merong 3 minus over 5 na muscle strength. Okay, and then for subluxation, no, not necessarily 3 minus over 5, but the indication here is that a presence of subluxation. No? If there's a presence of subluxation, then you apply FES for shoulder subluxation. Okay? Yeah. So, the picture seen here, no? This is the electrode placement for our ambulation. Okay? So, later on, discuss natin sila isa-isa. Naharangan pala to. Wait lang. Okay. So, for the shoulder subluxation, okay, this is the electrode placement. So, later on, discuss natin yan. For upper extremity function, it could be here, no? It could be a lot of combination, no? Meron for deltoids, okay, and then sa rhomboids. Or it could also be a combination of your wrist extensors and then your elbow extensors. So, depende kung ano yung upper extremity activity na gagawin nyo. When we talk about FES kasi, no, di ba sa NMES, lagay nyo lang, stimulate nyo lang yung muscle, and then pagkatapos nun, okay na. No? With your FES, aside from the stimulation, okay, we incorporate a certain activity. That's why it's called FES. Okay? So, we'll discuss that more during our lecture. Okay, now let's go to your shoulder subluxation. Please take note of the parameters because once you go for your face-to-face, no, all of the parameters that we have talked about, no, babalikan ulit natin yon. Okay, para mabilis lang kayong mag-demo pagdating sa face-to-face session. So, these are the following parameters, no? You can pause the video para i-copy ninyo yung parameters. Okay? So, those are your parameters. Pulse duration. Okay? Para hindi na tayo mahirapan pag nag-face-to-face, no? The machine that you ordered kasi, no, iba yung terms na gamit nila, no? Hindi siya pulse duration nakalagay doon. It's pulse width. Okay? Pulse width. Okay? For the frequency naman, ang tawag naman nila doon sa yung nakalabel sa machine is pulse rate. Okay? Pulse rate. Okay? Para hindi kayo mahirapan, no? Kasi minsan, ito yung tawag, minsan iba. Titignan nyo yung unit. No? Kasi meron doon, beside the number, meron yung unit kung microseconds or hertz. So, kapag nakita nyo yung unit nung parameter is naka-hertz, then obviously, you are adjusting the frequency or the pulse rate. If nakita nyo yung nagbe-blink, no, is dun sa may unit na naka-microseconds, more likely you're adjusting the pulse duration or the pulse width. Okay. For the ramp up and down, no, you have 3 seconds each. And then for the duty cycle, okay, you can start with 1:5, no, to progress to maximum of 15:1. Depende kung ano yung to-tolerate ni patient. Okay? Yan. When we say 1:5, ibig sabihin nun, yung 1 here represents 10 seconds. So, meaning you have 10 seconds on and 50 seconds off. Okay? 10 seconds on, 50 seconds off. Okay? Treatment time would be 20 minutes. Okay? So, ano yung amplitude niya? Again, ang amplitude natin, no, walang certain measured kung ilang milliampere ang i-apply ninyo. That's why, di ba, paulit-ulit nating sinasabi to, that amplitude, the level of current amplitude that you apply to patient differs from individuals. Okay? So, para lang malaman nyo kung magsa-stop na ba or hindi, no? When we say amplitude, yung gusto nating makita, no? So, you stop, no, if nakita nyo na merong elevation of the head of humerus. Okay? During the F to F, makita nyo yan, no? Yung elevation of head of humerus. If merong abduction, ibig sabihin, the amplitude is too high. Okay? If merong abduction, the amplitude is too high. Okay? Ang gusto lang natin, head of humerus, nag-elevate. Okay? If in case na ang taas na nung amplitude, pero hindi pa rin nag-elevate yung head of humerus, then, no, probably, merong mali dun sa pag-place mo ng electrodes. So, you really have to palpate and search for the muscle belly, okay, of the targeted muscle para dun yung ilalagay yung electrode, no? Because yung Rheo base and chronaxy natin, okay, the basic Rheo base and chronaxy natin is at the motor point. And when we say motor point, no, 'di ba? Yun yung area kung saan konti lang yung kailangan mong i-apply na electric current, but it can give you, no, a optimal contraction. Okay? So, this is the placement for shoulder subluxation. One electrode is placed at the supraspinatus. Okay? And one electrode placed at the posterior deltoid. Okay? Yan. Now, if the patient is too small or the patient is too thin, okay, to the point that it's difficult to isolate the posterior deltoid, you can target the middle deltoid. Okay? Pero, yun na yung last resort natin dito. As much as possible, if you can find the posterior deltoid, okay, then you place it here. Okay? You place it there sa posterior deltoid. Bakit ito yung dalawang target for your shoulder subluxation? Okay, commonly kasi shoulder subluxation happens sa acute stroke natin. So, these two muscles are the primary muscles that pulls the humerus superiorly. So, when they weaken, ito yung nagko-cause for the humerus to sublux. Okay? The supraspinatus, no, if there is an option, no, if nabigyan kayo ng magkaibang size ng electrode, may isa kasing, sa amin kasi noon, merong binigay na isang set for large electrode and one set for small electrode, no? If possible, meron din kayong ganon. A large electrode is placed at the supraspinatus and a small electrode is placed at the posterior deltoid. Okay? Para mas stimulate si posterior deltoid. Di ba kapag smaller ang electrode, mas increase ang current density. Okay? So, we kinda needed that with your posterior deltoid. Kasi medyo mahirap kasi siyang stimulate si posterior deltoid. So, para hindi natin kailangan masyadong mataas na milliamperes, okay, na amplitude, you could reduce the size of the electrode. No, if possible lang naman, if hindi, no, we can deal with equal size of electrodes for your supraspinatus and posterior deltoid. Okay? So, ano yung goal natin dito, no, pag nag-apply for the shoulder subluxation? As discussed, no, you start 1:5 and then progress to 15:1. Okay? Yan yung, hindi ito 1:5 tapos diretsong 15:1, ha? Dahan-dahan nyo siyang i-progress, no? Kung 1:5, magiging 2:4, okay, or kaya 3:4, okay, eventually reaching the 15:1. Ang goal nyo kasi dito is to improve the endurance of the muscles. Okay? So, you can only improve the endurance if you, if the patient able to tolerate, no, yung long on time, okay, or yung increased on time, and decrease naman ang off time. Okay, so that's for your shoulder subluxation. Next would be for the upper extremity function. So, you could pause the video again and take note of the following parameters. Okay. As you can see here, no, ang duty cycle natin naka-NA. Okay, ibig sabihin kasi niyan, no, it depends kung ano yung desired function or yung desired activity na gusto nyong paggawa kay patient. Nasa sa inyo kung ang patient ba is too weak or too slow to execute the needed task. Okay? So, itatansya nyo yan kung ano ang on time niya and ano yung off time niya. For example, for your upper extremity function, si patient, meron siyang difficulty in releasing objects. Okay? Releasing objects. So, ang activity ninyo would be grab and release. Okay? Pag nag-grab si patient, naka-off. Pag magre-release na siya ng object, naka-on yun. Okay? So, let's say, si patient, di naman siya ganun disabled. Okay, let's say, ang on time niya, okay, ang pag-release niya would take approximately 2 seconds lang. Okay? 2 seconds lang ang kanyang kailangan to release. No? So, that's going to be ang on time ninyo, 6 seconds. No? Bakit naging 6 seconds? Kasi you have to include the ramp up and down. So, if you have 2 seconds for ramp up plus 2 seconds for ramp down, okay, yung 2 seconds na tinansya mo kanina na needed for the release. Okay? So, pag-add mo yung tatlong yon, it would equate to 6 seconds. Okay? Remember, kasi yung ramp up na yan, gradual yung pagpasok ng kuryente. For ramp down, gradual na pag-exit ng kuryente. No? So, i-account nyo rin yun sa on time sa duty cycle. For the off time, no, gano'n naman katagal si patient mag-grab. Okay, let's say, kailangan niya lang is 3 seconds. Di 3 seconds. 3 seconds. And then, on time, release. Tapos ulit-ulit. For the treatment time, no, approximately ito siya. No, but, you could also, no, kayo bahala, no, if you would want it time, yung upper extremity electrical stimulation, or i-base niyo siya dun sa repetitions ng grab and release or whatever activity na papagawa niyo kay patient. Pwede din yun. Okay, sa amplitude, achieve the desired function. Okay, sa F2F malaman yan kung ano yung achieve desired function na yan. So, hindi siya not necessarily na yung ES na yung gagawa ng 100% work ng, for example, pag-release no object. At least, ang gusto natin dito, at least it would help initiate, okay, the action. Okay, so not really 100%, at least it would help lang, no, the patient to achieve the desired function. So, depende dun sa gusto ninyong activity, and depende kung ano yung mga weak muscles kay patient. No? Dun depende yung number of pairs of electrode na kailangan ninyong i-attach. Next would be FES for ambulation. No? We apply FES, no, for ambulation mainly to assist dorsiflexion or assist the foot clearance. Okay? So, to avoid falls, okay, or trip, okay, isa to sa fino-focus natin in our program. Okay? We want to improve the dorsiflexion of the patient. And these are the following parameters. Okay? As you can see, no, pwede nyo ulit i-pause yung video to take note of the parameters. As you can see, duty cycle, just like your upper extremity function, depende kung gaano katagal ni patient kailangan yung dorsiflexion. Okay? Baka kailangan niya lang for about 3 seconds. Pwede din man. Or 2 seconds lang. No, mabilis pala siyang maglakad na, pero may konting improvement lang na kailangan for dorsiflexion. So, depende pa rin ang duty cycle ninyo. Okay, sa ability ni patient to, or sa how quick the patient could do the task. Treatment time, okay, kapag napagod na si patient, okay, or hindi na ma-elicit yung dorsiflexion, ibig sabihin nagkaroon na ng fatigue sa muscle. Okay, pag hindi na na-elicit yung dorsiflexion, alright, ibig sabihin nun, stop na. Okay, stop na pagkagan. With this one, no, another thing to note, okay, ayun, amplitude 3 minus over 5 contraction, ibig sabihin, at least, no, half, okay, of the ROM ang motion ng dorsiflexion with the help of the ES. Okay? Another thing to note here, no, very important ang correct electrode placement natin. Because if it's not a correct electrode placement, ibig sabihin, if hindi mo na target precisely to the motor point, okay, it would mean that you will need a lot of milliampere, okay, or you would require a lot of electrical current, no, na ipasok dun sa muscle. Okay, and greater current amplitude would mean, no, na mas mabilis ma-fatigue yung muscle. Since ang treatment time natin dependent dun sa muscle fatigue, gusto natin na ma-target yung motor point para kahit konting kahit konting milliampere lang yung ina-apply natin, or kahit konting electricity lang yung ina-apply natin, nakakapag-produce ka na kagad ng contraction. Okay, so how do we make sure na yung tamang area ang merong motor point? So always palpate for the muscle and find the muscle belly. Yung gitna ng muscle belly, yun yung applyan niya ng electrode. Okay? Yan. Okay, so this is for your FES, no? These are the summary, no, for FES. Now let's go to ES. Wait lang. Before we go to ES, no, shoulder subluxation, yun nga, no, review lang natin ng konti. Shoulder subluxation, yun nga, better if you could have smaller electrode for your posterior deltoid. If you cannot isolate the posterior deltoid, okay, you could also target the middle deltoids. Okay, for supraspinatus, if available, no, yung larger electrode. Okay, Again, ang goal natin dito is to increase the on time and decrease the off time. Okay? Because what we want here in shoulder subluxation is to improve the endurance of the muscle. Okay? For the upper X function naman, no, yan, as is. Okay? The intervention here, no, may need to last longer than 4 weeks, no, for an effect. Okay? Para ma-observe natin yung effectivity ng treatment. Okay? So, ibig sabihin, kakailanganin ni patient ng more than a month of sessions with you. And then, for ambulation naman, no, again, this is used for foot clearance. So, yun ang focus natin when we use FES for ambulation. Okay. Next would be your ES for denervated muscle. Okay. In Miklovitz, no, actually, dalawa ang magiging parameters natin dito. Okay? So, you could pause, no? Etong nasa left side, this is the parameters for high-powered ES machines. Okay? High-powered ES machines. Usually, ito yung mga kailangan isaksak. Okay? Kasi kung makikita nyo, mataas ang pulse duration niya. 1 to 450 milliseconds. Hindi na micro, no? Milli na siya. Okay? Again, if you can still remember in our strength duration curve ng muscle, di ba? Ang mga denervated muscle, they will require more energy, okay, to produce a contraction. No? Mas mataas ang Rho base and pronaxin nila. Okay? Treatment time would be 30 minutes. Okay? Amplitude, there should be a visible contraction. No? Visible contraction. So, parang pumipintig-pintig yung muscle. Okay? So, etong sa right side, ito naman yung parameters that we use for portable ES machines. Like yung mga gamit natin. Okay? Yan. So, for the pulse duration, we use 300 microsecond. And then, for frequency, 1 Hertz. Okay? Tapos, ang treatment time niya, it could be 20 to 30 minutes. Okay? Tapos, ang amplitude niya, visible fine contractions. Okay? Just a note, no? For portable ES machines, ang mode na isa-select nyo to stimulate the denervated muscle is under the tense mode. Okay, dun sa tense mode. And then, select nyo yung letter B. Okay, yung burst mode. Okay, burst mode. Okay, and then select these. No? 1 Hertz, 300 microseconds. So, that's for your denervated muscle. Okay, yan na kasi yung 300 microsecond na kasi ang maximum ng portable ES machines. Okay? So, when we use EMS for denervated muscle, since it's denervated, alam natin na hindi na intact ang PNS niya. So, paano natin siya na co-contract? Paano natin siya na-enable mag-contract? When we use this, the clinician or the practitioner is attempting to directly activate the muscle through depolarization of the sarcolemma itself. Hindi na tayo dun sa mismong nerve. What we are trying to target here is the depolarization of the sarcolemma. That's why you can notice, ang frequency natin, ang maximum frequency natin is 1 Hertz. Yung pinakamababa na Hertz para mas targeted yung muscle talaga itself. Okay? Yan. So, kaya in your portable ES machine, ang parameter na i-observe natin, yung maximum for both of those. Maximum for the frequency is 1 Hertz and maximum for the pulse duration would be 300 microseconds. Okay? And that would be the end of our lab. Okay? Ayan. So, if you have questions, no, feel free to ask. Okay? Ayan. Feel free to ask on our next session, no? Definitely in our lecture time, no, on Friday. Okay? Thank you.